Hello and welcome to Tête à Tête, France 24's flagship interview show. Our guest this week is Dr. Jean Kaseya. He's an epidemiologist. He's a Director General of the Africa Center for Disease Control and Prevention, Africa CDC as it's known. He joins us from Kinshasa, the capital of the Democratic Republic of the Congo, where he has come to assess the impact of the Ebola epidemic in the eastern part of the country. Thank you very much for being our guest today.
Thank you so much for having me.
Dr. Kaseya, the DRC health authorities have now recorded over 1,000 confirmed cases, at least 267 deaths, most of them in the eastern Ituri province. According to the World Health Organization, transmission is accelerating despite beefed up response measures. So is this Ebola epidemic out of control?
Thank you so much. I will clearly say that and loudly say that I cannot say that this outbreak is out of control. No. What I can say, this outbreak is serious. We are responding to an outbreak in a context of huge humanitarian crisis, and we are responding to an outbreak in an environment of insecurity, and that one doesn't help. But the response is also massive, and I want to congratulate the government of DRC for what they are providing, including the 50 million that they provided to respond to this outbreak, and also the expertise that they are putting in place. We are still fighting, but I can say there can be hope.
There can be hope, but has the peak of the epidemic already been reached or not yet?
No, I cannot say that we reached the peak. Why? The reason is simple. You know, when you are managing this kind of outbreak, your major key performance indicator is the contact tracing. How many people were in contact with those who are positive, and you can have them in a list. If in this list you start to see some cases becoming positive, you will not worry too much because you know that you have control of your list. But if you don't have people in the list becoming positive, it means you have what we call the transmission at community level. That one must worry us. But currently, we have 150 million people living in camps. These are the internal displaced people. And we saw in these camps people becoming positive, but we don't have access to these camps. And we need to have access and to know the contact list, and then to see if we can have the control and then to predict about the peak. For now, the answer is no. I cannot say that we reached the peak of this outbreak.
Right. There are estimates that there are over 35,000 people who have been in contact with infected individuals, and the so-called patient zero has not yet been identified, correct?
For now, we even don't know when exactly this outbreak started, and we don't know the index case. It means the patient zero.
Right. The American CDC is warning that without a sustained effort to quickly isolate the sick, the outbreak could approach the scale of the one we saw in West Africa a decade ago, which caused over 11,000 deaths. Is this the trajectory we find ourselves on? Could this be even more mortal?
When you take a photo, and this is what we did on 16th of June with our head of state, when you take a photo of this outbreak 4 weeks after the declaration, you compare with all other Ebola outbreaks for the same period of 4 weeks, this one is the most serious one. And this is the message we are giving to our member state, to our partners, if we don't stop this outbreak now, and it must last 2 years like in West Africa, yes, more likely we'll have more deaths, more cases than the West African one, than the Eastern DRC one in 2018.
Right. This Wednesday, a first case was announced here in France from a doctor returning from the DRC. There was a case with American nationals a few weeks ago. This begs the question. Yes, it is mostly in the east of the DRC, a little bit in neighboring Uganda, but could this epidemic cross oceans, reach Europe, other continents? How big is that risk?
When Africa CDC declared this outbreak on the 15th of May, we already spoke about a regional outbreak. And we already flagged that no one is safe if we don't control this outbreak at source. Now, we had a meeting with President Tshisekedi and President Ndayishimiye from Burundi, who's the African Union chair in Kinshasa. We discussed about how to accelerate the response, and we identified this humanitarian crisis that will request to move from 581 million we're requesting to $1.4 billion to stop this outbreak. And if Western countries, they are not just to worry about what could happen in the future to their countries. They have to come now. The cost to stop this outbreak is still lower than what they can invest to respond to this outbreak in their countries. This French medical doctor was in Ituri. He was working with an NGO called Alima. He was infected. And I know I will speak with the director, European CDC, to understand the context and also to start to track people from DRC, those who were in contact with him. But it's just an alert to say, let us give appropriate funds now to stop this outbreak where it is without waiting for other countries to be infected.
Right. The problem on the ground, you mentioned the humanitarian situation. There is also a security issue in the east of the DRC where we've seen combat on a large scale. And the problem is that the patients are generally arriving too late in the health infrastructure that's still there. And there are also misgivings by the population and so on. And this makes the issue even more difficult because it's not only purely a health problem, it's also a humanitarian and a security problem as well.
Yeah, it's a two-way, your question. First, you are talking about the mortality that is, the case fatality rate that is higher than the normal case fatality rate for Bundibugyo. This is exactly due to the fact that people were coming to the hospital when it was a little bit late. And you will see if you compare, North Kivu has a case fatality rate around 60%, while in Ituri we are around 25%, 24%, and the average is already above 25%. If people they can come to hospital when they have the first symptoms, that can help to save life. The second way for your question is, how can we make sure that we have all people and we can control the outbreak? Yes, let me give you the approach of 4-in-1. We need to provide funding to you to contain the outbreak, not only Ebola. This region is also where we have measles and cholera. Measles and cholera are killing even more than Ebola. Then we need to control that. The second one is we need also to deal with this humanitarian issue by dismantling some camps and sending people back to their villages, supporting them, providing the necessary tools for them to start with some other activities, not to be in the camp. By doing that, we are also resolving the security issue, because some of these young people are those who are fueling rebels or rebellions in some areas.
Right. There is no treatment, there is no vaccine for this strain of the Ebola virus. Is the West doing enough when it comes to this, finding a treatment, finding a vaccine, and also funding the effort that you're calling for? Are they doing enough? Or because they're cutting aid, like especially the Trump administration, they're looking the other way?
Let me repeat loudly and clearly what I said several times. if this outbreak was in Europe, any country in Europe, if this outbreak was in the US, was in other Western countries, they will already find vaccine and medicine for this outbreak. They didn't because they were not interested. It's for Africans. Let us just consider all of us were human beings. Let us consider that all of us, we are flying, we can be everywhere. The French doctor who is infected is not African. This is why we are saying it's time for us as Africans to know that we need to start to deal with our own issues. And yes, those who want to support us will come. I'm not crying about, and I'm not begging about others to give us this one or that one. No. We are leading what we can lead in Africa. Those who want to support, they are coming to support. Now that we have a strong Africa CDC leading this response, you will see, as we did for Mpox, you'll see that we'll have vaccine for this disease in the next 3, 4, 5 months maximum. By the end of this year, vaccine for Budubungyo, medicine for Budubungyo will be available. And those who want to celebrate that with us, Western countries, will celebrate together. If you don't want to be part of that, with what we have will continue in Africa.
But do you think the cuts, especially by the Trump administration, explain partly the lack of response that we're seeing for this outbreak? And could this portend the response that could happen for other diseases in Africa?
Look, it's not just about US cutting funds to Africa. It's almost all Western countries cutting funds to Africa. And this is the truth. In Europe, the majority of countries are cutting funds. Then let us not shift the blame. It's time now to be more responsible. It's time to say, look, we did what we did. This is one of the consequences of the action that we did. Now let us come together. I think this is the message clearly we are saying, and we think that good people, they will change their mind and they will come to work closely with us.
Dr. Jean Kaseya, thank you very much for being our guest from Kinshasa, the capital of the Democratic Republic of the Congo. And thank you for watching this show here on France 24.